is nutritional assessment. You will be given 8 minutes for this station. Okay, you will be given 8 minutes for this station. And Emer, is this a writing station? It's a combination of a writing station and you need to talk at the end. So it's a mixture of a station. So before I go to the next slide, what do we know about MUST? MUST is what's developed by BAPEN. It's a charitable association that raises the awareness of malnutrition, and they work to advance the nutritional care of patients and those at risk for malnutrition in the wider communities. Okay, so that is your BAPEN. That's the organization who made the MUST. And the NICE guidelines recommend this tool. That's why we use it widely. So it was developed in 2003. Okay, so that is the history of your MUST. And there are 5 steps for MUST. And you can see it on your screen. So the definition of MUST is to identify adults who are malnourished, at risk of malnutrition or undernutrition or obese. Remember, obesity is also a form of malnutrition. And of course, it includes the management. So that is your step number 5, to develop a care plan. So as you can see on your screen, we have 5 steps. Step 1, 2, 3, 4, 5, and we will be discussing that in a minute. So there are 5 must steps, like what I've said. I hope you've seen this table before. And definitely, you will see this on your examination. Again, no one has ever received this examination before for adults. The nutritional assessment is already present for mental health nursing Osce and for learning disability. They've been doing this for quite some time now. So, a disclaimer, we don't know how it would look like on your examination. Okay, they might change it. All right. So assessment criteria number 1. So the first criteria is, of course, to accurately calculate the BMI and the score in step number 1 of the screening of the malnutrition universal screening tool or MUST. This is one of the forms that you will see for the MUST. Okay, let's recap. Let me ask the crowd, how do we compute for the BMI? Well done. So the BMI is equal to kilogram divided by, so weight in kilograms, and then divided by height in meters squared. You only need to locate where the BMI is. We will do it in a minute, yeah? And you don't need the actual BMI. What you need is the BMI score. Again, you need to check, of course, the BMI, but what you actually need on the examination is the BMI score. As you can see on your screen at the bottom left, you can see if the BMI of the patient is more than 20 or more than 30, which is obese, the patient will score 0. If the BMI is 18.5 to 20, the patient will score 1. And if the patient scored 18.5 and below, or that is, the patient will score 2. As you can see on your screen, there are scores. Yeah, let's quickly discuss the tool. So this tool represents both the metric system and the imperial system. You can see the kilograms, you can see the meters, you can see stones and pounds, and of course you can see height in inches and feet. Okay, so I know in the UK we use the metric system. Yeah, in the UK we use the metric system, so we're using kilograms and of course meters for the examination. Let me give an example. On the examination, there will be a scenario, and the scenario contains all the information. So tonight, instead of me giving you a full scenario, we will break down. Example number 1. The patient's weight is 83 kilogram. The patient's height is 1.7 meters. What is the BMI? So the patient's BMI is 32. So what you need on the examination is the BMI score. So as you can see here, on the left section of the document, you can see the kilograms, the one I circled, yeah? At the bottom of the screen, you can see the height, which is 1.7 meters. You only need to locate those numbers and, of course, connect it, and you will see 32 on the screen. Can we all see 32 on our screen, yeah? And, of course, I just circled it so you can see it. You don't need to write anything here, yeah? You don't need to write anything here. You can see 32, and 32 falls under the score of 0, okay? Again, you don't need the actual BMI. What you need is the BMI score. So our score for step number 1 is 0. Okay, are we all following? The score for the first step is 0. It's not 32. Okay, so I hope we are all following. So you can see the graph. You have 0, you have green is also 0, yellow is 1, and then red is number 2. Okay, there is another example. What is your BMI? Let's start with what is your BMI first and what is the score? If you can type the answer. I know you're converting. What's 5 feet 6 inches in meters? Well done. Okay. Next, assessment criteria number 2. Okay, we will now proceed with the next criteria. So you have to identify the percentage of weight loss and accurately calculates the score in step number 2 of the must. Okay, so according to our must, for the unplanned weight loss in the past 3 to 6 months, if the percentage score is less than 5%, the score is 0. Okay, if the percentage weight loss is between 5 to 10, the patient will score number 1. And of course, if it's more than 10%, it would score 2. Okay, you will see this graph once again, or this table on your examination. I will give an example. The patient weighs 53 kilograms and lost 3.5 in the last 3 months. What is the percentage weight loss? It's already there. So the answer would be 1. Okay, so the answer would be 1. So you can see 53. I don't know if you can see the circle. It's 53. And then the percentage weight loss is 3.5 in the last 3 months. So you can see here on the yellow section, it's between 2.8 to 5.9. And if you look up, you will see the patient will score 1. Okay. So if the patient weight loss is, you can see it, isn't it, for number 53. If the patient's weight loss is less than 2.8, the patient will score 0 for 53. Yeah, for 53. If it's between 2.8 to 5.9, the patient will score 1. And of course, it's more than 5.9, the patient will definitely score number 2. Okay, are we all following? So you only need to locate what is the current patient's weight, and then next is what is the percentage weight loss, and you have to check what the score is. Again, all this information will be written on the scenario. Okay, you only need to to know the score of step number 2. Okay, let me do another one. The patient weighs 69 and lost 9.2 in the last 3 months. What is the percentage weight loss? So let's see, 69 and the patient lost 9.2 kilograms. So that means the patient's weight loss score is 2. Okay, that should be easy. Yeah, are you all following? I hope so. Yeah, I hope you're all following my example. So again, all this information will be written in a scenario. I'm just breaking down the scenario so we'll be able to understand it easily. Okay. Step number 3, you have to interpret the clinical information provided and accurately calculates the score in step number 3 of the must. So step number 3, it talks about acute disease effect score. So the score for step number 3, it's either 0 or 2 only. Okay, remember this? The scoring for step number 3, it's either 0 or 2 only. If the patient is acutely ill and has no nutritional intake in the last 5 days or so, the patient would definitely score number 2. If the patient is fine in terms of eating, or the patient has no acute disease or illness, the patient will definitely score 0. I will give an example. Let me know what the answer for the scenario. An example, a patient was admitted in the hospital 2 days ago due to chest infection and has been receiving an IV antibiotics. The patient has a pure appetite and receiving IV fluid. What is the disease effect score? Type your answer. Is it 0 or 2? Some of you said 0, some of you said 2. So again, guys, read step number 3 properly. If the patient is acutely ill and there has been or is likely to be no nutritional intake in the last 5 days. So according to the scenario that you can see on your screen, the patient is experiencing chest infection and on antibiotics. Do we not consider that as an acute illness? What do we think? Is that not an acute illness? So the answer would be 2. Okay? So the patient, and think about it. Yeah, think about it. Let's try to think about it. Let's try to analyze the scenario. If the patient experiencing chest infection, yeah, try to imagine a patient with chest infection. Will you not consider the patient at risk of developing malnutrition? Yeah, try to think about it without reading the definition of step number 3. If your patient has an acute illness, is that patient not at risk of malnutrition? Of course, the answer is yes. Even although the patient is on IV fluids, the nutritional intake that the patient is receiving is poor because of the disease process. Yeah, I hope we are all agreeing with that. Of course, another premise for number 3 is, of course, if the patient is not eating in the last 5 days, of course, the patient will also. Next, assessment criteria number 4 is accurately calculates an overall risk score and identifies the correct risk category. Of course, number 4 is easy. You're only adding step number 1, step number 2, step number 3, and you will get step number 4. So again, if the patient scored 0, that is low risk. If the patient scored 1, that is medium risk. Score number 2, score 2 or more, definitely high risk. Okay? Any questions for assessment criteria number 4? It's only adding steps number 1, 2, and 3. Okay? It's only adding steps number 1, 2, and 3. So that should be easy. So assessment criteria number 5. So this is the documentation part. So assessment criteria number 5 says documents date, time, and signature where required. So this is an example of how you will document on the examination. Again, we don't know if this is the actual documentation. It's just my interpretation of the documentation. You might see the date and time. Step number 1, of course, let's say step number 1, you said 1 or the score was 1. Step number 2, the weight loss score is 2. Let's say step 3, the acute disease effect is 2. You will be adding 1, 2, and 3. You will get step number 4. The answer would be 5. So based on this example, what is the score of the patient? What does the patient fall under? Is it no risk, medium, or high risk? So definitely, let's recall 0, it's low risk, 2 is medium risk, and 2 and above, which 5 falls under. That means the patient is at high risk of developing malnutrition. Of course, you have to put your name. That's my name. And of course, your signature. Okay, you can write your initial. Any questions so far? So see, you don't need to write the actual BMI. You don't need to write the actual percentage. What we actually need on the examination is the actual score. Okay, there you go. And so from marking criteria number 6 to number 10, it's the time you're going to talk. Okay, so from criteria number 1 to number 5, you only need to write and read the scenario. Again, from criteria number 1 to number 5, you only need to write and read the scenario and interpret the scores. From criteria number 6 and the rest, you have to talk. Okay, you have to talk. Again, you will be doing it within 8 minutes. So definitely be mindful of your time because you don't have an hour to do this. Once you've done the documentation, you're probably handing over. Okay, you're probably handing over. Number 6, you have to verbally report the findings to the examiner. So what you're about to do now. So number 7 is to verbally recognizes that the patient will need referring to a dietitian or nutritional support team. So of course, based on my example, the patient scored 5. So definitely, as you can see on your screen, step number 5, your management guideline, it says here, 2 and above, you have to refer to the dietitian, nutritional support team, or implement the local policy. So that is number 7, okay? You have this on your examination, but you can start memorizing this by heart, yeah? Memorize this by heart. So definitely, the patient scored 2 and above. It's a must for us to refer the patient to the dietitian or nutritional support team, which is written on your screen, on your step number 5 management guideline. Number 8, of course, you have to verbally propose a plan to improve nutritional intake. Okay? So guys, let me ask the crowd, what would be our plan for this patient? Okay? If the patient scored 5, what do you think? Let's try and recall our nutritional care plan. What will you be telling the assessor? What should we be doing? A small frequent feeding. Well done. There you go. Your food and fluid chart, definitely. Eating food which is high in nutrients and energy or high in calories. Yeah. Take high protein or caloric diet. Well done. So those will be the things that you will be handing over to your assessor. Okay. What else? How about improving the appetite? How do we improve the appetite? Of course, it's a problem if the patient doesn't eat. Even if you give like high protein, high caloric diet, if the patient will not be eating, it's nonsense. Food preference, well done, PM, okay? Food preference, of course, you have to collaborate with the patient, okay? Food diary, well done, okay? And verbally proposes monitoring the patient's nutritional status, okay? As you can see on step number 5, it will tell us the monitoring frequency. So for low risk or 0, it says here, repeat screening if you're in the hospital weekly, care home monthly, community annually for special groups, example for those more than 75. For number 1, for medium risk, you have to observe. It says here, document dietary intake for 3 days. If adequate and little concern, hospital weekly, care home at least monthly, community at least every 2 to 3 months. If inadequate, clinical concerns, follow local policy, set goals, improve and increase overall nutritional intake, monitor and review the care plan regularly. Okay? And of course, you will be using your critical judgment, yeah? Your clinical judgment for the scenario, based on the scenario that you will be getting. And of course, 2 and above, it says here the monitoring frequency would be if you're in the hospital weekly, care home monthly, community, care home monthly, and then community would be monthly. Okay? Unless, again, there is an unless there, detrimental or no benefit, unexpected from nutritional support, example, imminent death. Yeah? Of course, there will be an exemption. So let's try to practice, yeah? And of course, verbally considers possible underlying causes, provides food choices, and offers assistance with feeding if required. Actually, it's already written on number 10. So let's say, let's do a simulation. Let's say, assessor, my must score for my patient is 5. So my proposal would be, of course, I will be referring the patient to the dietitian and nutritional support team. And I will be, let's say we're in the hospital, monitoring the patient's care plan every week. Yeah, I will be monitoring the must of the patient every week. And of course, I will promote small frequent feeding. I will ask for the food preference of my patient. I will increase or encourage to increase fluid intake. I will also educate the patient about the food diary, like what you mentioned. I will educate the patient the importance of taking high protein and high caloric diet. Okay. I will involve the patient selecting probably the food choices. And of course, I will be assisting the patient with feeding if required. Okay. This might be this might be the things that you will be saying to your assessor in examination. Okay. Again, you can improve what I said. Yeah. Again, you can improve what I said, but again, try to think what you're going to say in the examination. Actually, assessment criteria number 6 to 10, it already tells you what to say on the examination. Yeah. So we can predict based on criteria number 6 to 7 that the patient's must score would be 2 and above. Do you agree? Yeah. Do we agree that the patient probably on the examination would score high, not 0? Because of course you will need to refer the patient to the dietitian, and of course you have to improve the nutritional intake. Okay. So based on the marking criteria, I might be wrong, but I think that is what we're going on on your examination. Do we have any question before we move on with the last one? No questions? All right. So the last 3 would be easy, 10, 11, and 12. 11, 12, 13 rather. Of course, your handwriting should be clear and legible. Strike through, we've discussed this earlier. And of course, you have to act professionally all throughout the station. Okay? So do we have any question for nutritional assessment? I hope I made it clear. I hope you learned something.